Hey guys, long time no see. If you don't know me, my name is Nash, and I started this channel to talk to you about topics that are near and dear to my heart that I didn't have anybody to talk to when they started happening to me. So today I want to talk to you about something that I have been dealing with for 14 years. Without further ado, PCOS and infertility. So like I said, I have been dealing with this now for 14 years. And if you're not familiar with PCOS, that is polycystic ovarian syndrome. In addition to PCOS, kind of hand in hand is insulin resistance. So with all that being said, it's important to know with polycystic ovarian syndrome that this really can have a huge effect on women, mainly for infertility reasons, which I will be discussing as well. So if you've ever wondered if you have polycystic ovarian syndrome, PCOS, I'm going to give you symptoms of what you can look for that the PCOS Foundation has listed, okay? Now, really quick, so I'm going to read off the paper here just because I cannot remember this many symptoms, but so PCOS, the symptoms, right? So we have irregular menstrual cycles, we have weight gain, specifically overweight, problems losing weight really hard, excess hair growth on the face or the body, darkened patches of the skin, skin tags, infertility, thinning hair is one of them. I don't know if you knew that. I recently just learned that a few years ago. Insulin resistance, type 2 diabetes, high cholesterol, high triglycerides, high blood pressure, cysts on the ovaries, pelvic pain, depression, anxiety, sleep apnea, which if you don't know, that is when you stop breathing while you're sleeping. Okay, so it's just a short period of time that you stop, but it's important and it's a huge risk factor. So sleep apnea, and then decreased sex drive and also increase in stress levels. So those are a lot of the symptoms of PCOS. Now I'm sure there's more. I'm sure they're coming up with something in addition every day to add to that list, but for right now, this is what the PCOS Foundation lists and describes what PCOS is, okay? So this is actually kind of a new topic to be researched and studied. It's only been studied now for about 75 years, which is really not a long time. So doctors are not 100% familiar with this. A lot of doctors are still learning about what PCOS is. 5 to 10% of women who are at childbearing age are affected by PCOS. That's a lot of people, especially in the United States. If you think about it, 5 to 10% of our population, it's crazy. And the biggest, problem that I notice is that 50% or more of women go undiagnosed, right? And then last but not least, 70% of fertility issues stem from PCOS. It's totally crazy. But PCOS is responsible for a lot of the female hormones. Now, like I said, insulin resistance, this is kind of hand in hand. And I'm going to explain it to you just like it was explained to me, because it is a lot of in-depth medical terminology that are just 18 letters long. It's over my damn head. So insulin resistance, this is kind of how it was explained. So with PCOS, the premonition is that cysts form on the ovaries. And when these cysts form, it sends false signals to the brain stating that the body's getting enough estrogen, which in fact, it's not. So this is kind of where this happens, right? So insulin resistance actually works in the pancreas. And with the pancreas, your body produces insulin. Insulin is what we use to fuel our body, right? So if you've ever heard that old saying, like football players, carb up before they have a game, right? They eat pasta, they eat anything they can with a lot of carbs, because what it does is it breaks down in the body and it fuels, right? It gives you that energy, that burst of speed that you need. Problem is that when you have polycystic ovarian syndrome and your body is insulin resistant, they don't know how to work together. So bottom line is, the idea is that your body and your pancreas don't work together, okay? So when the pancreas is creating all of this insulin for your body to use as fuel, the body is not accepting it, right? It's not using it. And when the body doesn't use the insulin that is produced, it stores, okay? It stores as sugar in the body. And when it's not used, it turns to fat, right? This is the whole idea. With PCOS, with people having weight gain, being overweight, and unable to lose the weight, this is why. It's very hard for people to understand this. So when your body and your pancreas don't work together, the insulin does not get used as fuel. So it sits there and it turns to fat. So it's very hard. You can even go on a 500 calorie diet a day, work out 8 times a day. Been there, done that. It doesn't work, okay? So a little bit about my journey. Like I said, I have been going through this now. Crazy to think, 14 years, it's been a long time. And this has pretty much happened right after I had graduated high school. So back in 2002, 2003, I'd gone to college and I had gained 70 pounds in 6 months. It's a lot of weight to gain. It's one of those things where everybody's like, oh, don't worry, it's a freshman 15. Well, there's difference between 15 pounds and 75 pounds, right? I was constantly working out. I was cutting my food. I was eating leaner. I was watching my calories, and clearly the weight wasn't coming off. At this point, I started to turn to weight loss programs and diet pills and just every fad at that time that was going on with weight loss. You know, I think diet pills were a huge breaking point at that time. So you can imagine I was trying everything I could. Now, between that time of being a freshman in college to the time that I had moved down to Columbus, Ohio, I had struggled with my weight a lot, and I had gone to the doctor, you know, and it was the same thing: cut your food, exercise more, watch what you eat, but nothing had changed. And I come from a very small town in Ohio where at that time there were not a lot of specialists around, so not a lot of people knew what PCOS was or insulin resistance. When I had moved to Columbus, I had started going to different family doctors, started seeing specialists, dietitians. I had changed gynecologists quite a few times. I had tried Jenny Craig, I tried Weight Watchers, I tried Nutrisystem, I tried the medication Adipex, right? Like, these are just Band-Aids. They don't fix the situation. They just allow you to live in that exact moment. Now, you can lose 10 pounds, right? Like, none of that's hard. Problem was keeping it off. But if you couldn't keep it off, your 10 pounds just gained up to 25 pounds. And that was the hard part. As fast as you lost it, you gained it right back plus more. So, the thing is with PCOS and insulin resistance, because it's only been studied for 75 years, it's very hard when people can't understand what your body's going through, right? Especially, and I use this as the biggest one, is overweight. Because, you know, we have an epidemic on our hands in the United States that people who are, you know, bigger or fat, I'm going to say, the notion is that they eat 12,000 calories a day, right? They sit on their ass, they don't work out, they eat buckets of fried chicken. Like, that is just how our society and our culture has kind of come to the idea of why people are overweight, which is not really the case, especially in this situation. So, my own personal experiences is that my family, they didn't understand, right? They thought I had to have been eating something wrong. I wasn't working out enough. I wasn't trying hard enough. I wasn't being honest with what I was doing. Friends, you know, they support you, but, you know, sometimes when, you know, you're in a situation where you don't know what's happening, it's hard to express that. I had I joined, I don't know how many gyms at this time, and, you know, they always had specials that if you signed up, you got a, you know, free session with a personal trainer. Let me tell you, these trainers piss me off so much. And the reason why I say they piss me off is because they always thought they knew something, which they didn't, okay? In this situation, the goal was to do cardio. Cardio is what burns fat. Well, guess what? It doesn't work that way. But they, you know, they would say there's no such thing, you know, as your body not losing weight. There's no such thing as, you know, if you cut your calories, you're not going to lose inches from your body, and that just wasn't the case. So, you know, I kept pushing forward. I did everything I was doing. Like I had mentioned before, I was going to different gynecologists. Took me quite a while, but I had found Dr. Frank Isabel in 2010, and unfortunately he is retired. He's kind of my savior at this point, because I had been going at that point 7 years not knowing what was wrong with my body. And if you're a female and you know something's wrong, you keep going for the answer, right? You just know something deep down's not right. And I felt like I had tried everything that I could try to lose the weight, feel better about myself. You know, it reflects on your self-esteem. And that wasn't the kind of person I am. I'm very proud of who I am, what I look like. You know, I was proud of everything that I could do. But when you go to different doctors and different specialists and you tell them what's wrong and you say, listen, I've done A, B, C, D, E, F, G, all the way to, you know, Z, and they still look at you and say, I don't think you've expressed all of your options to lose weight, you just feel defeated. And that's kind of how I was feeling at this time. So I found Dr. Isabel, and by this point I am, like I said, I'm defeated. I'm in there, I'm standing on the scale, and I'm bawling my eyes out to this guy. I'm like, I don't know what's wrong with me. I've gained all this weight in this short amount of time. I've done A through Z, and nothing is helping. You know, same dialogue to tell me, you're not doing it right. But it immediately he knew exactly what was wrong. He expressed to me that I had PCOS and insulin resistance, and there was nothing I could do to fix it. I could eat 200 calories a day, work out 50 times a day, and it wasn't going to come out. I'm very grateful to have met him and worked with him in the short amount of time that I did get to, because he really opened my eyes up. In order for us to diagnose me, we did two things. We did a transvaginal ultrasound, and then I did a 3-hour blood glucose test, which is the exact same test that pregnant women use to see if they have gestational diabetes. So 3-hour blood glucose came back and up and down, right? So you drink this big giant sugary drink, you have a baseline blood test, then every hour for 3 hours you take a sample of blood, all over the map. So at that point we knew that I was insulin resistant, my sugar wasn't being regulated in my body properly, and then with the transvaginal ultrasound, my ovaries at the time were just filled with cysts. This is how I was diagnosed. Like I said, very thankful, very grateful for him. And just moving forward, medication. I wasn't diabetic, but I was having problems with, you know, my body using all that insulin. If you're familiar, you know, there's metformin, I did Byetta, I did Bydureon, I did Victoza, and I did great on these. A year or two when I met my husband, and very short, you know, engagement, wedding. We were engaged in less than a month of meeting, and we were married in less than 6 months, and we have been together over 6 years now, and it's the best thing ever. So, you know, we wanted to start a family immediately, and I had this thought in the back of my mind for the longest time that it was going to be hard for me to get pregnant. I don't know why. I just always had this like thought and this feeling deep in me. We immediately found the best reproductive doctor down here. Is that all those amazing medications that I had just listed before, they, you know, they helped me lose weight. But the problem was none of these medications are tested during pregnancy. You don't know if they have a birth, you know, if they affect the birth of your child or the development of your child. So the idea was you need to cease all of your medications that are related to your pancreas. So in a matter of 1 month, I gained over 30 pounds. My body was pissed. It had gone backwards instead of forward. I was hurting again. And we did this back and forth, just kept jumping on one new medication every time we could to try to get some of the weight off, but at the same time we were trying to hit that little small window of being able to get pregnant and have a child. We were unsuccessful. We about 4 years. It wasn't, 4 years straight. We took breaks in between there, but we had 3 miscarriages, which if you've been through this, you know that every single month that you do a Clomid insemination treatment or anything like that, you get a negative, it breaks your heart. It breaks you down. It really does just, it puts a damper on your life. It just kind of puts it on hold, like, and we'll talk about that. Like, I totally understand it. I sat there, I've cried my eyes out over it. And then of course, miscarriages. Those are the hardest right there. Especially because I'd never experienced a miscarriage ever. So when the first one happened, I didn't even know till I went to the doctor, and I'm like, oh, hey, by the way, this happened. And he's like, wow. He's like, yeah, you had a miscarriage. Right? Sucks. It really does hurt. Here we are, 2017, and I have kind of been on a crusade to change my life. I was working out quite a bit. I stay regular with my doctors. My A1C is nowhere near becoming diabetic. My sugars are good. I'm healthy. I'm happy. I want to see how I can treat or eradicate PCOS. I've spent, God, how many years now? What'd I say, 14 years overweight. Not being able to do a damn thing about it. Miserable. And my body hurting. My joints hurting. My daughter, I have a 3-year-old, and I'm 33 years old. I don't want to constantly be working out 2 to 3 times a day. I don't want to exchange that time with my family for a medical issue I can't control. And we have to do more. There has to be a better way to treat this. So, like I said, I'm on a crusade. I will give you my journey, and I hope that if you have questions, you ask. If you are just feeling some type of way, comment, message me, email me. You're not alone. I didn't have anybody. Like, this time growing up, nobody even knew what PCOS was. So I felt very alone because I didn't know what was happening. I knew there was a problem, but I didn't know what. And, when doctors or physical trainers, they can't, put a label on it or diagnose it, it's very quick and easy for them to turn around and play the blame game. And I was tired of being patient shamed. Okay, so please do not get any of this video mixed up with the idea of not giving a shit about what you look like or about what you eat. Okay, I do know people that weigh 300 pounds because they eat McDonald's 4 times a week, or they eat pizza, or they sit and they watch TV all the time. Okay, I'm not talking about that. I'm talking a truly active person, a female that does it right and just still has a problem physically in her body that's not allowing her to be who she is. Okay, so I hope you guys take this journey with me. Like I said, I'm excited to be back. I'm excited to be doing the videos. This will be a journey together, and this is, like I said, the first step. I wanted to get this out back in January or February, but everything happens for a reason, right? So I hope you guys have an amazing day, amazing week. I will try to get this edited and up either tonight or tomorrow. But please never feel alone. I promise you're not. So I hope, like I said, hope you guys have a good one. I will talk to you soon, and we'll catch up. Have a good one, guys. Bye.